Hi, my name is River Yeo. I'm a Nurse GAPS Practitioner. Welcome to my office at the Yeo Wellness Collective. Today I want to cover some topics that people usually don't talk about in the health and wellness setting, and that is cost, money, the cost of healthcare. It's going up more and more every year. It's crazy. I remember when I got my first job and had to pay for my own insurance for the first time through my job. It was incredibly expensive. It was almost as expensive as my rent. And I am a healthy young person who, is very low risk, no problems that were really diagnosed or anything. Yeah, crazy. And I was just looking for the cheapest possible one because I wasn't expecting to need it. So why is health insurance so expensive? Why is healthcare period so expensive? I want to discuss some of these things because we spend more on healthcare in this country than any other country in the world, and our health outcomes are terrible. So I just want to talk about some reasons why I have, in my experience as an RN, this system is so expensive. So let's jump into it. When you get sick, when you feel sick, if something comes up and you think, this doesn't feel right, or I don't know what this is, what do? You go to the doctor. If you have a primary care doctor, which most people don't, you can go to your primary care doctor and it costs slightly less. If you go to a bunch of specialists already, you go to your women's health doctor or your joint specialist doctor or whatever. A lot of doctoring has been split up into many specialties, and a lot of people just go straight to their specialist for things. You have a problem, you go to a doctor, okay? You go to see that doctor, you spend some time with them, not much time, just a little bit of time. And more likely than not, that doctor, God bless their heart and soul, were not properly trained, or even if they were properly trained, were not able to keep up on the physical assessment skills that can tell them anything about what's wrong with you. So they will do the obligatory place this stethoscope. Hold on, let me get my stethoscope. And I remember doing this as a nurse all the time. You're not here for your heart. I can't really hear your heart rate very clearly right now through this sweater, but I'm just gonna do the obligatory, ceremonial motion of listening to your heart and listening to your lungs. And it's like a ceremonial process, because honestly, if you ask your doctor, have you ever just listened to someone's heart and actually heard something abnormal? They will probably say no, because even if there was something abnormal, there was a study done one time where they tested a bunch of doctors with different heart sounds, and they were cardiologists. Actually, they weren't just doctors, they were cardiologists, and 90% of them missed the heart problem that was in the scenario. So not to the fault of the people, but just the fault of the training and the system and the way that they churn people through really quickly in appointments that are really fast. There's no way to keep up with good physical assessment skills. And in most cases, we just weren't taught proper physical assessment skills. And there's a lot more to physical assessment than using some tool necessarily. You don't need a tool to physically assess someone. You can feel, you can touch, you can see and observe things. And even if you do notice differences, do you know what they mean? I was taught how to observe in nursing school, but we weren't taught what it means. Okay, someone is pale, maybe they're anemic. That was the only meaning that was attributed to physical assessment things. Maybe people's nails are brittle. Okay, what does that mean though? We didn't learn that. Maybe if you were blue, that's obviously a lack of oxygen, but there's a big deficit in this area of training. So you go to the doctor, you present with the problem, they listen to you for your quick explanation, they take a look at you, they ceremoniously move their stethoscope across you, and what do they do next? Are they able to tell you what it is? I guarantee not. Of course, they're going to send you to testing because they can't assess you physically. They weren't trained. They don't have the skills. So, and I'm speaking as one of myself. If I was the person that you came to see in a clinic and I was the nurse for the doctor and I was doing all the assessment piece for them, I could not tell you what is going on necessarily for your situation. I could tell you a list of most common meds that are assigned to those observations, but I couldn't tell you the meaning behind the observations and whatever is weak or what is the cause of that now we're treating with the symptoms of with pharmaceuticals, if that makes sense. Again, and not to bash people in the healthcare system. The healthcare system is broken. The people are wonderful, but the system is not ideal. It does some great things with trauma, but when it comes to chronic issues, when it comes to health and wellness and things, and minor health problems that are not life-threatening, anything that's not life-threatening, it cannot treat, basically. And I like to think of it, I was thinking of it this way recently. Healthcare is not really health care. We're not caring for your health. It's really illness care. If you have a severe illness, we're going to care for that. We're treating the illness. And it's very different from a more holistic model where we are actually doing health care. Like we're caring for someone's health and wellness. We usually call it wellness because the term healthcare just means, the mainstream system treating, symptoms with meds and illnesses with meds, and that's called healthcare. But really, it's not healthcare. I guess unless you say, oh, they have ill health. But anyway, does it really matter which words we use? I'm not sure. It only matters as much as we associate secondary meanings to the word. But anyway, so why does it all cost so much? Here we go. We'll have a lot of rabbit trails today. You go to the doctor, bing, you pay the doctor. You go for testing, bing, you pay for testing. Most likely multiple kinds of testing. Blood testing, some kind of imaging testing, x-rays, MRIs, maybe biopsy testing. It's like a mini surgery basically. If you're getting a biopsy, it's basically a mini surgery. We are stabbing you, not for a therapeutic purpose, for an assessment. And so we pay for all those things, and it is incredible to me the amount of testing that my clients go through before they come to me. And the people will, spend hours and hours and days doing different kinds of tests that are long and stressful in a cold hospital environment. And at the end of the test, they're given a title of whatever their problem is and no explanation for why that is happening and no explanation for any kind of treatment. And if they get an explanation for some kind of treatment, like changing your diet, this person and this person and this person that are all in the same healthcare team will give you completely different advice. Your primary care, your GI specialist, the person who did the test, they could say, oh, you need more fiber. Oh, you need less fiber. Oh, you just need to eat more salads. Like if those give you off the cuff, kind of offhand, oh, just eat less calories, and yeah. So with all of that money we just spent with all of those different people, the person who is the secretary sitting at the desk of your primary care office, the primary care doctor, the specialist receptionist, the specialist nurse, the specialist, the multiple testings, and then when it all comes back around, what treatment is there? None, or maybe some meds to help your symptoms, and those are also costly. And the thing is, we're spending money in all of these areas that are not actually addressing the actual problem. And that, you could say, is a waste of money. And I talked a little bit about this in my testing video. Watch this before you do all the testing, so check out that video for more on testing. But basically, we spend a lot of money just in the system trying to do something, and we're not really doing much. So when this happens with one person, it costs them quite a bit of money. But when this happens on a systemic level, where every single specialist is doing this, and they're coming up with new tests all the time that we don't really know what they mean, but let's order it because let's try and learn about this situation. It costs a lot of money. And not just for that person, but for the entire group of people in the insurance system that person contributes to. So a lot of people, we look to our health insurance for insurance. Not just insurance, but assurance. If anything goes wrong, it'll all be taken care of because I'm paying them so that they can just take care of it. So that if something goes wrong, I don't have to worry about, oh, can I afford treating myself? Can I afford treating my family? We can just have it off of our mind. Whatever it takes, we can do it because it'll be worked out. And so many times working in all different areas of nursing, patients ask me, how much is this going to cost? How much is it going to cost for a day's stay? How much does this test cost? How much is this med cost you're giving me right now? How much does it cost? And we can't answer. We have no answer. As the nurse, I have no answer. I have no one to refer them to give them an answer. It's a mystery. And so this mysterious disconnect between the patient or client and the actual cost is unhealthy. And it causes us to spend money. We're basically, as the in-between people, we spend money that we are spending the money instead of the patient choosing where to spend the money, and it ends up not working out. I personally, and it's difficult because most Americans, you already have chronic disease. You have multiple chronic diseases. You have multiple meds you're on. You have multiple specialists, and you're dependent upon them. And so you need insurance to negotiate your relationship with them, because that's how you got connected initially, and it's like you're in the system. If you're not already in the system, if you're pretty healthy so far, or if you want to get out of the system, that's your choice. Personally, I believe insurance, the purpose of insurance should not be for all the preventative things and all of the scans and yearly checkups and everything, but it should be for emergencies. If I get into a car crash, you can rush me into surgery and fix my leg back together the way it should be. That is what insurance should be. It should be insurance, but it should not be assurance. Yeah. Personally, our family uses a health sharing plan, which is what insurance started out as, I'm sure, once upon a time, where a group of people all put money into a pool, and then if something crazy happens to one of those people, the money goes to them. Very simplified, without all the bells and whistles and codes and numbers and bureaucracy and micromanaging of the practitioners that insurance currently functions in. So that's what we do. It's incredibly affordable, it's incredibly cheap. And with the savings that we have from not paying an extra $600, $700 for insurance, we use that money for alternative care, which is not covered by insurance. And it can be difficult to have both insurance and afford for alternative care. Some people do it, can do it, and a lot of people when they come to me, they already have health care insurance. And so they say to me, well, can I get a discount? Because I'm already spending so much money on this, I don't have enough money left over to spend on what you're doing. And the problem I have with that is, as much as I love to help people out of the goodness of my heart for free or for cheap, when I, have time with clients, I'm paying someone to watch my baby, and I'm spending time away from my baby that I could be with my baby, and instead I'm spending it with you. And the kind of medicine that I am practicing, which is food, is the real medicine. So I feel like the real medicine, the medicine that's treating the source of the problem, is worthy of financial investment. And in my opinion, more worthy of financial investment than the other, some of the excessive use of expensive testing that's repetitive in all directions with no plan of, if the test comes back, what will we do? So that's how I feel about money and the healthcare system, and why the healthcare system is so expensive, why insurance is so expensive, some ways that people can support their health apart from insurance, and yeah, why and how I don't take insurance, because insurance has changed from insurance to basically a healthcare government system. Like, the insurance tells you what to do. And if you want, you can check out my other video about why I left my care management position and what my experience doing that was like. I worked basically for the insurance company. And yeah, so if you want to learn more about that, check it out. Anyway, that is why healthcare is expensive. And this is why I believe in the depth of my soul, like, it is very important to invest money into preventative care. And even people in the mainstream medicine world know this and talk about this all the time. But the thing is, there's no means of doing it currently in the mainstream system that works. There is no, the only thing they have is meds. So then they start giving meds preventatively for preventative care, and that doesn't make sense at all. But yeah, or they refer to a dietitian who, God bless them, were educated with some outdated information that was affected by politics, and has nothing to do with the more up-to-date information that is taught in master's level programs or by people like Dr. Natasha Campbell McBride. So, all that to say, healthcare is expensive, but it doesn't have to be. It doesn't have to be expensive. It doesn't have to be that expensive. If we spend less money on frivolous things that are not helping us, and more money on the things that really matter, and time on the things that really matter, the simple things in life, healthcare will not be so expensive. I have another video coming out right after this one where I'm going to talk about food and why food is so expensive, or the cost of food and what that means. So I'm interested to see what kind of discussion this brings up. I really have a heart to bring this type of healthcare or wellness care or food as medicine kind of knowledge and appointments to people who can't afford it, to my immigrant friends and people who just generationally were, disadvantaged and already, are in tons of medical debt, maybe because of using the mainstream healthcare system, or came into a tragedy of some kind. And I am looking forward to expanding my family email list, where people can donate to help fund the care of some of those people to be able to fund their care. That's the way we should do things, I think. Just doing it with community, churches, and community members coming together to help each other and give each other a leg up. So, yeah.